we'll be discussing this by organs. So for the eyes, we have your pupillary muscles that allow for meiosis or constriction and mydriasis for dilation. The muscle responsible for meiosis is your constrictor pupillae, and for mydriasis, it's your dilator pupillae. You also have your ciliaris muscle, which allow for the flattening or for the roundedness of the lens. Under the sympathetic response, your pupils will dilate and your ciliary muscle will flatten your lens. So this will allow for your eyes to have a wider visual field. So you can see everything that's happening around you in a stressful or emergency situation. And at the same time, your lacrimal glands will decrease their secretion. This means lesser tears will be produced during a sympathetic response. In comparison with the parasympathetic response, there will be constriction of the pupil and curving of the lens. So this will allow the eyes to focus on one single object or one specific location. Since you are in a rest or digest state, there is less importance to being aware of your surroundings. And your lacrimal glands will now produce more tears or lubrication for your eyes. Next, we have your salivary glands. So under your sympathetic response, there is decreased in production of saliva and therefore more viscous saliva is seen. So this is because saliva is partly water, and this is one way in which your body can conserve that water. It's to decrease the secretion of saliva. So the lesser water content would allow you to have more viscous saliva. This is the reason why you tend to have a dry mouth during stressful or emergency situations. On the other hand, with your parasympathetic response, there is an increase in salivation, increase in salivary amylase production, and a more watery saliva is formed. And this is because you are preparing your GIT, your body and your mouth, for the process of digestion. Increased salivation would mean that there would be more saliva to mix with the food that you masticate or chew up so that it's easier to pass it forward or to propel it to your esophagus and therefore to your GIT. Salivary amylase is an enzyme that breaks down carbohydrates. Next, we have your cardiovascular system. Under the sympathetic response, your nodal cells, which are your SA-AV nodes, and your bundle of His, your Purkinje fibers, which are responsible for the electrical conduction of your heart, can increase your heart rate. For your myocardium, which is known as the muscle of the heart, they can increase cardiac output and stroke volume. And lastly, we have an increase in blood pressure under your sympathetic response. So the increase in blood pressure is because of peripheral vasoconstriction, meaning the vessels on your limbs, on your central body, they are all constricted, but at the same time, your coronary arteries are dilated. Your coronary arteries are the blood supply to your heart. And remember, there is an increase now in cardiac output and stroke volume. So your heart has to accommodate for all that extra blood flow. So it does this by vasodilating your coronary arteries. In comparison with your parasympathetic response, your nodal cells decrease heart rate or they slow down your heart rate. Your myocardium decreases your cardiac output and stroke volume, and there is also a decrease in blood pressure, and this is because vasodilation primarily happens within your central organs, specifically focusing the blood supply or the blood flow to your gastrointestinal tract, so you'd be able to perform better absorption of nutrients from the food and better digestion and movement from the GIT organs. Next, let's talk about your respiratory system or pulmonary system. Under your sympathetic response, bronchodilation is needed. This is to accommodate the extra air going in and out of your lungs, especially in stressful or emergency situations when a person is hyperventilating or is breathing very deeply, as in after an exercise or during an exercise. As well as under the sympathetic response, we have a decrease in secretions. And that's why when you're under stressful, again, situations or under emergency situations, you are less likely to have a runny nose. In comparison with your parasympathetic response, there is bronchoconstriction and an increase in secretions. So basically just the opposite of what was said under your sympathetic response. Next, let's talk about your GIT or your gastrointestinal tract. So under a sympathetic response, everything is decreased. You have decreased peristalsis and motility. So that is decreased movement within your GIT organ. So no food or little food will be propelled forward to your GIT. There is also a decrease in gland secretion, so this would mean a decrease in production of hydrochloric acid, gastric juice, decrease in pancreatic juice. So all of the secretions of the GIT will be decreased, and this is to discourage or to inhibit the process of digestion, of chemical digestion. Next, you have your contraction of your internal anal sphincter. So your internal anal sphincter is kumbaga the gate or the passageway from the anus towards the external environment. So this is where your poop comes out when you're pooping. So contraction of the sphincter would mean closure of this pathway. So therefore, the process of defecation is inhibited or is stopped. And this is important because in stressful or emergency situations, you would not want your body to focus on digesting and defecating. Your internal anal sphincter is actually involuntary. So this means that under a stressful situation or under a response to an emergency situation, your body will physically not be able to defecate. In comparison with your parasympathetic response, so we have an increase in peristalsis and motility as well as absorption. So there is increased movements within your gastrointestinal tract. You also have increased gland secretions because now we're trying to promote chemical as well as mechanical digestion. And as well as you have here relaxation of your internal anal sphincter. So this means that when it is relaxed, it is now open and therefore you will feel the urge to defecate. Remember, you have two anal sphincters. You have an internal anal sphincter, which is involuntary and controlled by ANS, and you have an external anal sphincter, which is now voluntarily controlled by your cortex. So, this is the reason why, for example, although sometimes you feel the urge to defecate, you are still able to hold your feces in or hold that urge in because the last sphincter it has to pass through is voluntary. Next, let's talk about your pancreas and your liver. Under the sympathetic response, your liver undergoes a process known as glucogenolysis. So lysis means breakdown and gluco pertains to glucose. So there is a breakdown of glucose inside the liver under a sympathetic response. This breakdown of glucose will allow for the various cells of the body to take up all that extra glucose to give them more energy to properly respond to a fight or flight scenario. For the pancreas, you have a decrease in insulin production, an increase in glucagon production, and at the same time, these two things will cause a decrease in blood glucose. For an overview of their functions, your insulin is responsible for taking glucose out of the circulation and into your cells. At the same time, it is instructing the liver to convert glucose into glycogen for it to be stored there. So kumbaga, it takes glucose out of the blood and into the cells and into the liver, so therefore decreasing the blood glucose. Glucagon, on the other hand, detects decrease in blood glucose. So, for example, when a person has hypoglycemia, your glucagon detects that, and then it tells your liver to break down the stored glycogen, which came from glucose. It breaks down the glycogen and brings it back into glucose. And that glucose will now be added into your blood circulation again, therefore increasing the amount of blood glucose levels. Now let's relate it to your sympathetic response. So it says here that there is decrease in blood glucose. So that is the stimulus for all the actions that will happen in your pancreas. So why is there a decrease in blood glucose? So an explanation for this would be that, for example, in this fight or flight situation, you have already taken up most of the glucose currently in your blood circulation. So your pancreas detects that oy jutay na lang ang glucose in your blood. So it will increase its glucagon production para your glucagon will tell your liver to break down that stored glycogen and make it or turn it back into glucose. So glucose can be released again into your circulation. At the same time, your pancreas will decrease its insulin production. Remember, your insulin also plays a role in promoting storage of glucose inside the liver into glycogen. So we don't want that in an emergency situation because again, we want the liver to break down or ubuson ang glucose in the liver to utilize it for the fight or flight response, right? So a decrease in insulin production would mean that lesser glucose will be stored in the liver in this current state, in this current fight or flight state. And at the same time, it will be more efficient since hindi na amo na kadamo ang insulin and it will efficiently allow glucose to enter the cells. Okay? So increase in glucagon, decrease in insulin. So for your parasympathetic responses, it's just the opposite. Your liver undergoes a process known as glycogenesis. So genesis or enesis pertains to synthesis, making of, creating of. And what does your liver create or make? It creates glycogen. So for the parasympathetic response, this is influencing, or this is what you call this is promoting that your liver turn glucose into glycogen for it to be stored inside the liver. So this is important when you are in a rest or digest state, since your GIT is constantly absorbing nutrients and putting it into your bloodstream. So if your body will not utilize that glucose right away, it is being stored in your liver as glycogen, and that is the process of glycogenesis. For your pancreas, so again, it's just opposite. There is an increase now in insulin production, a decrease in glucagon production, and all these two responses are being triggered by an increase in blood glucose. So this time, since you're in a rest or digest state, there is again constant absorption of nutrients from the food, and one of those nutrients, of course, is glucose. So the glucose coming from your GIT will get into your bloodstream, and therefore it will increase your blood glucose. So due to this stimulus, your pancreas will react by increasing insulin production. And by increasing insulin production, you are promoting liver glycogenesis. By decreasing glucagon production, you are inhibiting your glucagon from telling your liver to break down that glycogen. Because again, your goal is to increase the storage of glucose by turning it into glycogen. And this is it for your liver and for your pancreas. Now let's talk about your urinary system. So under a sympathetic response, what your body wants is actually to inhibit or to postpone the process of micturition, voiding, or urination as much as possible. So to fulfill that response, you have here a decrease in urine production, a decrease in ureter peristalsis, your detrusor muscle will relax, and your internal urethral sphincter will contract. So all of these will contribute to postponing or delaying your voiding, micturition, or urination. So a bit of a background, your detrusor muscle is the muscle surrounding your bladder. So when this is in a state of contraction, you're actually squeezing urine out of your bladder. And when it is relaxed, you are allowing the bladder to fill to a certain capacity. And your urethra has two sphincters as well, just like when we've talked about your anal sphincters. You have an internal urethral sphincter, which is involuntary, and you have your external urethral sphincter, which is voluntary. So this also explains the reason why, although sometimes you feel the urge to urinate, you are still able to hold your urine in because the last sphincter it needs to pass through is voluntary. So for your parasympathetic response, so it's just the opposite. There is an increase in urine production, increase in ureter peristalsis, your detrusor muscle is contracted, and there is relaxation of your internal urethral sphincter. So correction on this part, please write it down. Your detrusor muscle under the sympathetic response will relax. So kailangan ni detrusor mag-relax in a sympathetic state because you are trying to avoid the process of urination, right? And under your parasympathetic response, your detrusor muscle will contract because under arrest or digest, it's okay to let your urine out. And also, when you're talking about sphincters, usually contraction of a sphincter would mean it is closing, and relaxation would mean it is opening. So under your sympathetic response, the sphincter contracts, therefore it is closed, therefore no urine comes out. And under your parasympathetic response, your sphincter is relaxed, therefore it is open, and therefore urine can go out. So this is it for your urinary system. The last one that we'll discuss is with regards to your reproductive system. So under your sympathetic response, the male gonad undergoes ejaculation and a type of erection known as psychogenic erection. For the females, there is what you call your uterine contraction. So the walls of the uterus are contracting. Under your parasympathetic response, for the males, there is what you call as your reflexogenic erection. And for the females, the counterpart is that the clitoris is also becoming erected. So what is the difference between a psychogenic erection and a reflexogenic erection? This mainly lies with which type of stimulus is provided to get the erection. Okay, so when you're talking about a psychogenic erection, the stimulus, of course, is thought provoked. So when a male is thinking or feeling some thoughts or feelings and it causes an erection, that is what you call as a psychogenic erection. On the other hand, your reflexogenic erection needs direct stimulus into the glans penis for it to happen. So what is the clinical significance for this? So this usually would get into the sexual capacities of your patient as well as their fertility issues when they have a spinal cord injury. So remember, when you have an SCI, you're not just damaging the motor aspect, you're not just damaging the sensory aspect, you're also having some problems with your autonomic nervous system. So to be specific in this case, if your L1 to L4 is damaged with a spinal cord injury, you would risk that you lose the capacity of having an ejaculation of or a psychogenic erection. Under your parasympathetic response, if the patient damages the S2 to S4 part of his spinal cord, then he is unable to perform a reflexogenic erection. But what about their fertility? So usually, a male patient who has had an STI, regardless of which level, even if hindi siya ka-ejaculate or ka-perform erection, they can still have children because the sperm count and the quality of the sperm will not be affected. So they can still do IVF or other procedures like that to help with their fertility issues. So one way to remember this is that the word sympathetic begins with an S, so that stands for shoot, SHOOT, which is ejaculation. And your parasympathetic starts with P, so that is point, and that stands for erection, specifically reflexogenic type of erection, where indirect stimulus is needed to the glans penis. So this is it for this discussion, reminding you to take care of yourselves and your mental health as well. Thank you for listening, and God bless with your exams for this week.